there's been a few questions that have really honed in on just specific partners in the work that we're doing in our community. And we've had questions on what the role of the school is, what role the school has in supporting students who seem to be on edge and lost in life. And I really hope as you're hearing each of these panelists, you're seeing how complex this issue is. You're seeing how much each of them are working together in the community and how they're supporting each other. But there's a lot of questions, or a few questions, that are coming to really ask that role of the school and how they're supporting students. So Missy, do you want to tackle that?
Sure. I think, as I mentioned earlier, one of the first things I would think about when you ask that question is just the curriculum that we talked about. You know, certainly we focus on that curriculum always with students, on helping them understand their feelings, helping them know who to go to, helping them learn how to problem solve, trying to build that resiliency within students. I think in addition to that, we want to make sure that they are connected, that they feel connected to people within the building, that they have adults that they can go to. I think it's important that you ask students, that we ask students both, you know, who is that adult for you, or who would you go to, or who can you go to, and make sure that every student has an answer to that question, so we know that they're connected to someone, or they feel safe going to someone to share their feelings. You know, I would say in addition to that, making sure that we provide that hotline information, as Jill mentioned earlier, that students know if it's at a time when they can't go to someone within the building, that they, you know how else to get help if they're feeling on edge or feeling, you know, that afraid of what they might do. And then another thing that I think is important to know is that if we are aware that students are feeling that on edge, we do have a screening process. We work with the parents, we call the family, we offer resources or let them know who else they can go to have supports for their child, including mental health providers that could provide that ongoing, more in-depth support for the student.
Jessica, yeah, being a clinician in the schools, would you speak to that a little bit?
Yeah, as Missy, as Melissa talked about, that when students are identified, they do provide referrals to outside providers. Our agency happens to be one of those providers where we work closely with the schools, and we also work closely with Region 3 and other partners to be able to provide services that are affordable as well. And so once we get that referral, then it really is up to us to contact the family, the parents, and work with the parents to set those services up. And if between us and the parents we're able to work it out to go to the school, then the school works with us to make that be appropriate for that student. But we also do work with students then at our office while we work with the school with students coming to our office. And so there's multiple options for that. I think it's important to note too that a lot of things that we work with, a lot of the issues we work with students on is not always appropriate to be worked on at school. And so that's why it's important for us to provide those different options for us when working with families. And that really a lot of mental health concerns are more appropriate to be handled in an office setting and not at the school, because schools are not equipped to be mental health offices. They are more equipped to focus on academics. And while we understand that our students have very complex things going on, we want to make sure that we are providing services that are needed to our students, to our youth, in all available ways. But I think that we work so closely with the school because of that, because we identified that the school is not a mental health office and that we are professionals for that.
Can I say one thing? I just wanted to let everyone know too that the Department of Education in the state of Nebraska has taken suicide prevention as very serious as well. And so they've implemented a 5-year training program within all of the schools across Nebraska where just completed year 2, in which they offer an evidence-based research model to all of the educators, and all of the educators are required to go through that training. So acknowledging that there's not enough suicide prevention training in our communities, across our communities, regardless of what system that you're talking about. But it's great to see that the Department of Education has really taken that serious and is requiring that staff and personnel attend those trainings.